Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is pediatric heart murmurs.
All a heart murmur is an extra sound that blood makes as it flows through the heart. These are very common things, especially in kids. And sometimes they can be indicative of an underlying heart problem, but more commonly, especially in the pediatric population, it's not a problem at all.
How common are heart murmurs in children?
In children, they're quite common. Most people agree that at least half of kids will have a heart murmur at some point. Some people think as many as 80% of kids will have a heart murmur at some point, especially if you're listening to them at the right time. So heart murmurs are much more common when kids are sick with something else. For example, they have a fever or their heart rate is elevated for some other reason. And it's oftentimes in those cases that an innocent murmur in particular might come about that you didn't hear before. And those innocent murmurs can come and go over time. So not all heart murmurs are persistent. Some can come and go. And so they're quite common.
Does someone with a heart murmur experience any symptoms?
You might experience symptoms if the heart murmur is the result of some underlying structural or functional heart problem. As I mentioned before, some murmurs are innocent, which is to say that they're not indicative of a heart problem. Some heart murmurs that are indicative of heart problems can result in symptoms, things, for example, like difficulty exercising, shortness of breath, chest pains, palpitations, things of that nature. But most murmurs in kids that we hear are innocent murmurs and don't have any associated symptoms.
Do innocent heart murmurs resolve themselves?
Most innocent murmurs will have a tendency to come and go over time and will eventually go away. However, there are certain folks who the heart murmur continues through childhood and into adulthood, and that persistence doesn't indicate that it's a problem. Again, if it's an innocent murmur, it's innocent and not anything that needs to be worried about.
How do you determine whether a child's heart murmur is innocent or if it calls for additional testing?
A lot of murmurs you can tell whether they're innocent or not innocent just by listening. There'll be certain features about the timing or the quality of the sound or the location of the sound that indicate that it's an innocent murmur as opposed to something that indicates some underlying heart disease. So sometimes you can just trust your ears and you'll know 100% whether it's an innocent murmur or not. Other times you need other types of testing, for example, ultrasound or electrocardiography, ECGs, to tell whether or not it's an innocent murmur.
What are the next steps if you discover that a heart murmur is a result of a heart defect?
The next step after diagnosing a heart problem, not an innocent murmur, but a structural heart problem or functional heart problem that results in a murmur, it depends a little bit on what the problem is. Actually, a lot of the problems that we diagnose in the pediatric population, they're structural problems, but they're small structural problems. For example, small holes between the different chambers of the heart, subtle valve problems, that sort of thing. And sometimes those subtle problems don't result in much symptoms or any significant danger for the child, and a lot of those problems will actually resolve on their own with time. Other problems do need to be addressed and do need further testing and further evaluation. Rarely, some of these problems will require more invasive therapy like a surgery or a catheterization to treat.
Should activities be restricted for children with heart murmurs?
We get a lot of concerns, especially around our athletic kids who come in with a heart murmur, because we get lots of concerns about the possibility of a heart condition that might put the athlete at danger. We've all heard the terrible stories about athletes passing out or passing away on the playing field. And that's obviously a major source of anxiety. Again, most murmurs that are diagnosed are innocent in nature, but when patients come to us in pediatric cardiology clinic, we're able to suss out if there's anything to worry about and recommend the appropriate testing and therapy if it's necessary.
Are there any restrictions if a child's heart murmur is innocent?
If the murmur that we auscultate, that we listen to with the stethoscope, is in fact innocent, there's nothing else to do. I always advise parents and families that the murmur is going to tend to come and go over time. We don't get too nervous if the murmur gets louder, for example, with an illness, because that's the nature of these murmurs. They come and go. Some days they're going to be loud, especially in the setting of a fever or other illness, and other times they might not be heard at all. Innocent murmurs, though, as long as they are innocent, don't require any specific follow-up. They don't require any particular precautions or exercise restrictions or anything like that.